Hi everyone, Tom Slivick, and welcome to TSPN's News In-Depth. And today I have Debbie Shally.
Yes.
Hi Debbie, how are you doing?
Fine,
Glad to
how
have
are
you
you?
here once again, and you're with HICAP.
I am.
Okay, and this program we're going to be talking about the annual open enrollment for Medicare Part D. I think I'm getting this right.
You are.
And we're going to be talking to Shally about that, and that's coming up soon, October 15th, especially if it's your first time, looking into Medicare. And we're going to take a break, and then when we come back, we're going to dive right in. So stay with us right here on TSPN.
You're watching Amador County's local television network, TSPN.
Hi, everyone, and welcome back. Tom Slivick with Debbie Shally. Debbie,
Thank you.
glad to have you back again. Now, we're going to be diving into the annual open enrollment for Medicare Part D. That's starting on October 15th through December 7th. But before we get there, we're going to find out a little bit more about you and your group. And you're with HICAP.
Yes, I am.
And HICAP sits under the umbrella of Area 12 on Aging.
Area 12 Agency on Aging,
Okay.
yes.
Why don't you tell us a little bit about maybe Area 12 to start with, and then we'll move into
Okay.
HICAP.
Area 12 Agency on Aging is your one-stop shopping for seniors and disabled services. We have the Family Caregiver Program, we have Information and Assistance, the Multi-Purpose Senior Services Program, MSSP. The Nutrition Program is based out of there.
Okay.
Lots.
Okay.
It's
Lots
a huge
of stuff.
umbrella,
So
yes.
Basically, then that. And HICAP is
And HICAP.
and HICAP is under there. And basically, it sounds to me like you're the health part of that, and especially Medicare.
Yes. Our specialty is HICAP is Health Insurance Counseling and Advocacy Program
Okay.
for Medicare beneficiaries or pre-Medicare beneficiaries, and we help them navigate the Medicare maze.
And it can be a maze, can't it?
Oh, yes, definitely.
Okay. Now, most people know, first of all, I guess you're 65 and over, then you fall into Medicaid. And you can be covered with Medicaid before that.
Care.
If you Medicare, sorry.
Okay.
Okay, all right, already, here we go. And, but that's disability.
Yes, if you're under 65 and on Medicare, it's due to disability. So you age into Medicare, age 65, and then there's the different parts of Medicare. And
Okay.
you start off with your Part A and your Part B, which is your traditional Medicare. Part A is your hospital, and Part B is your medical. Part C is a Medicare Advantage plan. It's an option you have a choice of making when you get into Medicare, and it would be like an HMO or a PPO or a private fee-for-service program. And then there's Medicare Part D, the last
Okay.
part.
All right. So let's talk just a little bit about A. Okay, tell us a little bit about A.
A is your
Part A.
hospital. It covers your hospital bed, your room, your services while you're in the hospital. You have $1,184 deductible for your first night stay in the hospital. It also
Okay.
covers your hospice. It covers your inpatient psychiatric hospital. It covers your home health if you had surgery. And your skilled nursing for rehabilitative services. And Medicare covers the first 20 days free of cost, and after that there's a copayment of
Okay.
$143.
And then B is what?
B is your doctors or your medical. It covers your doctors, your diagnostics, which is your x-rays, your blood works, durable medical equipment, which would be your walkers or your wheelchairs. It also covers outpatient psychiatric, and it covers diagnostic. I can't remember right now.
Okay, I think you probably covered
I think
it.
I did.
Okay. And C,
Is a Medicare Advantage plan. So if you were to choose a C, it takes it encompasses your A, B, and most times your D, your drug program, all in one.
and that's because you might wind up with a HMO.
Correct.
Or something like that, Health Maintenance Organization.
Yes.
And they generally put everything in one package.
Yes,
But quite a lot of people are using A, B, and D.
correct.
And D is the one that we're going to talk about, and that's the one that that you're going to be having your clinics on.
Our drop-in clinics,
Okay.
yes.
And tell us about D. What is D? I think the D stands for drug?
D stands for drug or prescription drug, yes. Medicare Prescription Drug Program is a federal program, and it is through private insurance companies. And this year there was 33 different insurance plans, quite a lot. And
Okay.
so every year during open enrollment, the clients should reevaluate their plan because the contracts with Medicare are from January 1st to December 31st, and any changes won't be go into effect until the 1st of the next year, this year.
Okay, so that's
14.
actually the fiscal year.
It's actually the actual year.
January, yeah, right.
The actual
That's-
year.
There we go again. All right, okay, senior moment here. Okay, so that part of the year, but you want to,
You wanna
have
make
to
your-
find out about that. Now, the paperwork and everything, people don't have that for the new upcoming year, right, the 14th yet.
No, they probably haven't been inundated with the sales and the information from the plans yet. It usually comes out the last week of September, beginning of October, because beginning of October is when the information is supposedly to be available to everyone. Not necessarily accurate, but available.
Okay, now, I know why it's kind of confusing because I've had to go through it, but why don't you tell people, you know, why it's something you really have to watch and take a good look at.
Okay. For example, a plan that you have this year, you like it, everything's fine, you say, I'm going to stay right where I'm at. Come January, you find out your drugs are totally different prices, they're not even covered. You knew your premium's going to go up because you got that letter. But what happens is the plans can change the tiering of a drug. So let's say you're taking Lipitor and they say it's a tier 1 drug, but next year they put it into tier 3 or tier 4. Your cost could have quadrupled right there. The co-payments can change by the tiering. They can also just change the co-payments. And so they can even drop drugs from the formulary. They can add drugs from the formulary. So unless you get reassessed to make sure that your particular medications are going to be covered for the next year, you're in a maze.
Okay, and so in a way, there's a lot of different, I guess, people that are programs that are vying for you to use their program.
No, we only
Not
use
for
the Medicare.
I don't mean the program then, I guess. It would be like which one you sign up for, which group, because isn't that where the 33 plans are?
There's 33
So
plans.
some of them have a drug that might be more on this plan, but another drug is less, and another drug, and so you need to look through all the plans to try to find out where you're covered the best.
Correct. But how we do it is we take the client's medications, we enter them into the Medicare.gov website, and it pulls up the plans by cost efficiencies for the client. So we do not deal directly with the plans at all. We deal with Medicare.gov, and we're not salespeople and we don't sell anything. We just assist them to make their best choices.
Okay, so it's fairly easy when they do it with you.
It's very simple because we already know the idiosyncrasies of the website, and so we can ask them the questions. What pharmacy do you want to go to? Do you want mail order? And we can put all that information in, and it'll pull up the plans based on what the client has told us.
Okay, well that
Medications and where they live.
Okay, well that sounds, real easy.
It is. It can be real easy, but we definitely have to have the medication list because that is
Okay.
particular to the person.
Now, here's a question: do a lot of people use you? Do most people in the county that that have this need to look at Part D new this year? Will they be making appointments with you, or do some people just try to go it alone?
Both. People who are currently on Medicare and new to Medicare do use our HICAP services. A lot of people don't even know about our HICAP services and that they're a free service. So there are still people that do not know about us, and I'm hoping this will help. But everybody who has a Part D plan should reassess their plan, just even for their own knowledge, to know that, okay, it's not the cheapest, but I still like what I have and I'm not changing. Then they still have the best plan that's for them. But as for new to Medicare, Social Security is very good about telling people, go see HICAP to help you navigate the system.
Okay, I think we're going to find out about some of the open enrollment dates and some of the
Drop-in clinics?
yeah, drop-in clinics and things like that when we come back from this break. So stay with us here on TSPN.
You're watching Amador County's local television network, TSPN.